Hello everyone, and welcome to this audio podcast. This audio podcast as part of a Corpuscle Quake, the Corpuscle Quake edition. This audio podcast as part of a Quake and Storm. This audio podcast as part of a Bostics Quake, and this audio podcast as part of a Storm Robotics production. This audio podcast, will have a little bit in around looking at sort of some of the literature in around reducing chronic kidney disease. So, an Australian investigation explored the viability or feasibility of early detection and treatment of renal disease or kidney disease by mass POCT or mass point of care testing. 12 randomized trials of angiotensin converting enzyme inhibitors were undertaken in 1,943 patients or recipients with varying degrees of renal impairment, uh, renal impairment, and protein where proteinuria was evident and where hypertension or abnormalities around arterial blood pressure had been evident, and the results showed or informed that the risk of developing CKD can be reduced in around 30% over a 2 to 3 year duration. In the POCT testing or point of care testing sort of model, this finding supports the requirement to, number one, utilize sort of a single dipstick test for proteinuria, two confirmatory 24-hour urine test for protein, and three to commence sort of administration of angiotensin converting enzyme inhibitors in suspect or high risk renal recipients. The investigation also informed that around 20,000 people over the age of 50 years are at the age of over 50 years would require to be screened to prevent even one case of CKD. And so to achieve this, approximately 100 people would need to be treated with angiotensin converting enzyme inhibitors for 2 to 3 years, and 1,000 would need to have a 24-hour urine protein investigation, and of these, approximately 700 would be false positives. And so, given the lack of specific early detection data from POCT or point of care testing in sort of the middle-aged and older patients with proteinuria, preemptive treatment of at least some with angiotensin converting enzyme inhibitors is a promising primary prevention strategy for preventing CKD. In around the investigation, large population-based cohort studies on the use of ACE inhibitors may help to answer questions such as one, what is an individual's risk of developing CKD given measured values for proteinuria, arterial blood pressure, and renal function. Number two, what is the advantage of ACE inhibitor administration in POCT point of care testing detected cases? And three, is psychological and physical harm caused by POCT, including the specific renal investigations and treatments that follow proteinuria detection. That draws this audio podcast to a close. This audio podcast as part of a Corpuscle Quake, the Corpuscle Quake edition. This audio podcast as part of a Quake and Storm. This audio podcast as part of a Bostics Quake, and this audio podcast as part of a Storm Robotics production.